Um, and we are recording this session for those of us who can't join us today. A lot of people asked, would we record the session so that it obviously can be shared with people who can't be on the call? So thank you so much for being here. It's lovely to have you all at our next webinar. This one, we're going to focus on mental health, particularly anxiety and depression, and how we can utilize the sensory processing framework for that. We are also sharing a meeting function of Zoom and not a webinar function. So I just want to make you aware of the fact that you can become very vocal and start to chat and share your background noise with us. So please be mindful and just keep yourself on mute just to help us to work through the content. So lovely to have you all here. I am going to share my screen with you. And I don't have my normal second screen with me, so I'm only going to see some people in the call. Yeah, great to have you all here. Just briefly, with me tonight on the call as part of the Sensory Intelligence team is Marianne Jacqueline. She is a facilitator who works for us and who does present work for our clients. She will be managing the Zoom back end with me. And then together with her is Amanda Oosthuizen, Lauren van Gelder, and Louanne van Heerden. They are all practitioners who's been through our assessments, who's been through our training, and they are presenting their case studies with us tonight. So maybe let's just start off and see some introduction. Can you just put in the chat box for us, where are you based and what is your background and your profession? So that we have an idea who's all in the call with us. I have scanned through some of the names at the beginning, a lot of familiar faces. Thank you all for being here. I wish I could all single you out individually, but then we will be chatting and not really getting to anything else. And then also your background and your profession. So it's really great to see who of you are all here. That's great. Mariana, you can check the chat box for us. I've got only one screen tonight, so I can't be over two or three screens that I normally do. And then are
Um,
there any, yeah, Marianne, are we all
all over the show, we've got people from up north, we've got people from the coast, we've got people from the UK, from New Zealand. So
awesome?
we're
That's great.
international.
That's really great. And are there any people in the call that has never had any exposure to our work? Any newbies? Why I'm asking that question, I'm kind of quite someone that go into context and share a little bit of the Sensory Intelligence framework. Tonight, I am not going to do that. We literally are, I'm going to do some positioning for you and then hand over to people that's going to share their case studies. So there won't be any context. Are there any newbies, Marianne, that we don't know about? No one?
Yes, they
No.
are.
Okay, great. For those of you who haven't been exposed to any of our work before, we have run the information session as well. There is a link, and we can always share that link with you. Then you can also check on our previous session, which had more context and more background. I'm not going to be providing a lot of background for tonight. So remember some housekeeping. Please keep yourself on mute. We are in meeting format. And then feel free to ask any questions in the chat box throughout the session. Marianne will be managing the chat box. And then towards the end, we've allowed time for Q&A. We will go through those Q&A in the chat box afterwards. So awesome. Thank you for being here. The recording will be shared with you afterwards. As I said, not many people, or there were many people who asked for it that can't join us tonight. Okay, so this is what we're going to do tonight. I'm going to give you a very, very brief framework. Why are we using sensory intelligence from a mental health perspective? And I am going to be a bit of my typical nerd and be sharing more research as opposed to just general information, because I do think there's so much research in this space being done, and that really substantiate the fact that we can apply these principles within the mental health space. Then there's going to be three real world case studies. Amanda Oosthuizen is going to share one. Lauren van Gelder is going to share one, and van Heerden, as I've explained already, they're in the course, in the call with us. And then third, towards the end, we'll just do question and answers. I see there are people still coming into the waiting room or into the call. You're really welcome. Marianne, thanks for managing that. So let's start with the juicy bit. I'm literally going to run you through, I think, 3 or 4 slides and sharing some of the related research in this particular field. For me, this is very, very important, knowing why we can position sensory processing within this particular field. As you can see, number one, depression. I've listed a lot of referencing there for you. There is a lot of research that has been done to show that sensory processing and depression are correlated with each other. In other words, if we measure sensory processing, there is a predictive factor that we can use to see are more prone to develop depression as well as anxiety. There's also a lot of work in the pain-related disorders, research and application being used for this. A lot of work in trauma. I think the trauma field is definitely growing. And this is not necessarily updated research referencing. Research are being added onto on a day-to-day basis. I'm struggling to keep up, like most of us do, but I think just giving you the correlation and the fundamental research that we can refer back to. Post-traumatic stress disorders, there's also relations to that, even anorexia and bulimia, OCD, obsessive compulsive disorders, schizophrenia, seasonal affective disorders. These diagnoses have all been linked to people with sensory sensitivity. And sensory sensitivity is correlated with low thresholds, which is obviously part of the assessment work that we do with clients. If we measure your sensory sensitivity level, your sensory thresholds, we know that we can predict some of these risk diagnoses. However, there's also a lot of people who are not diagnosed with a particular mental health disorder. And I think this is really important. This is the space that we as a core group function in quite extensively. A tendency for psychological distress is more common around people with sensory sensitivity. Their quality of life is often compromised. They are more prone to stress and burnout. Their sleep quality even is affected. And if we look at how they practice mindfulness, there's very particular trends that we are finding. There's correlation with eating behaviors, type 1 diabetes, health complaints, even headache severity amongst adolescents with migraine, for instance. So I'm sharing this with you again just to substantiate the amount of research that are being done in this field to show why should we be looking at this. The other flip side to it is if we look at sensory seeking, remember we, in the work that we do, we measure threshold. Do people have high threshold and sensory seeking, or do they have low threshold and sensory sensitivity? In the seeking group, we are seeing a lot of risk behaviors. They've got higher resilience, they have got fewer sleep disturbances, higher vitality, but there are more alcohol addictions and substance abuse. And internet addictions is also very common amongst this group. And they do tend to have less job stress and better psychological well-being when we compare it with the other group. So that's the correlation. Then I just want to bring you into, so we know mental health diagnosis or even mental health risk are associated with sensory processing. And then the next 2 slides is just showing you if we now use sensory processing as an intervention model, it does prove to be effective in that also a lot of other research have shown. Multisensory spaces have been used successfully to improve mental health. Self-regulation is a self-monitoring and problem-solving process that can reduce stress and discomfort, and raising awareness of individual sensory preferences to cope with challenges through self-regulation is something that has proven a lot of impact for a lot of clients. And you will hear from our case studies that this is exactly what a lot of the therapists that will be sharing their cases have done. The other one that I just want to share with you, sensory-based protocols and sensory modulation strategies, also which will be shared in our case studies, have been shown to reduce stress, to reduce anxiety, to lessen depression, aggression, and interesting, it has even resulted in the reduction of restraint use in mental health hospitals, which I think is a phenomenal research component to also explore. The other thing that I love about this work, a sensory modulation approach, which is what we substantiate and teach, are safe, it's cost effective, it's non-invasive, and it is a non-pharmacological intervention. It is using empowerment, self-management, and we really change people's lives through the concept of teaching them how are their systems in their body wired, and how do we use that to help them to manage their mental health. Right, so I'm going to give over. Let me see, what am I doing with time? I've done 10 minutes, which is great. I'm going to hand over to Amanda Oosthuizen, that I've got quite a special affinity for. We've helped Amanda to move into Century Wellness as a tool, and she's going to share the first case study with us. Thank you so much, Amanda. I'm going to hand over to you.
Thanks, Anne-Marie. It's a pleasure and a privilege. Do you see me?
Yeah, we can see you. Go for it, Amanda. You all
Okay,
here.
I'll go for it. Thank you. I'm Amanda Oosthuizen. I am a licensee and a practitioner. I also did the practitioner's course, and I would love to share this case of Susan with you. She contacted me via my website, saying that she wanted to lose weight and wanted to know what was all of this Century stuff about. Susan is a woman in her 50s. She's married. She has two teenage kids. She's a teacher at the international school with 35 3-year-olds in her classroom. So what are her problems? She reported to being overweight, feeling tired all of the time. She has high stress levels, generally feels that she's not coping, reports to having a lot of negative self-talk and not validating herself. So what we did, she filled out a Century Matrix questionnaire. The result of that was the total score was -4, indicating that she has medium thresholds, meaning that she was sensory neutral. But the individual scores taught us something else. So I'm quickly going to go through all of the thresholds for you, and then just to say what we did with each and every one of these areas. So for visual, she had a -3 low threshold. For auditory, she has a -7 low threshold. Touch was +7, a high threshold. Smell and taste was +8, high threshold. Movement -5, which is a low threshold, and then multisensory was also -5, low threshold. So what she wanted to achieve by this process was that she wanted to decrease her levels of stress and anxiety. She wanted to have less negative self-talk and more internal validation. She also wanted to lose 30 kilograms of weight. She would also prefer it if she could maybe use less alcohol, especially over weekends. So what did we do for her? We taught Susan some self-regulation strategies to calm her nervous system, and also provided her with more stimulation for her touch, smell, and taste senses, which seemed to be sensory seeking. We had a few discussions also about boundaries and assertiveness to aid her with that. So the following strategies were introduced. So for a visual system, she already had a jungle theme in her classroom. So she added a few plants just to reduce the color. So as part of her sensory diet, she likes reading in her free time. So the auditory sense was the most overwhelming one, where she experienced a lot of stress. So what she did, she taught the little ones in her classroom to do deep breathing, body stretching whenever there was a lot of noise in class. She also used calming music and relaxation exercises to be able for them and for her to cope with in the classroom situation. Imagine having 35 3-year-olds in a classroom. Anyway, so she didn't go to the staff room at break times when she felt overwhelmed. She also used noise-canceling earphones when preparing for the next day's work. Her touch system was the next one we addressed, where she was sensory seeking. She gets her energy from connection with family and friends. So now she goes for walks after lunch with her husband. She walks barefoot at home mostly, and when she's going to the beach, she loves the barefoot walking. Regularly goes for a massage, and then spends more time doing crafts like sewing and coloring instead of doom scrolling on her cell phone. So for smell and taste, Susan loves spicy food. So although they are provided with meals at school, she takes a tapas-style lunch for her to have instead of having the food at school because it tasted bland and didn't suit her needs. She changed from having wine at dinner to having sparkling water with slices of lemon at dinner time. She still goes to restaurants, but she's making healthier food choices. She does food shopping online. She only orders the food that she's going to use tomorrow. She orders today. She plans her menus a month ahead and then just weekly checks in with the family whether that suits their needs. The movement score is -5. I found her choice of activity very interesting, and the way in which she changed it made a lot of sense for her. So before knowing all of this, she did rebounding exercises and stretching before going to school. And after school, she would engage with aerobics and weight training with her son at the gym, which totally overwhelmed her. So now she does some meditation exercises before school, and after school, she either does yoga or Pilates classes. Instead of visiting restaurants with her girlfriends, they regularly go out for walks together. She's just had a shoulder operation, and when she's recovered from that, she will go back to playing golf, which she loves as an activity. So for multisensory, what we did was we helped her to plan her time, to manage her time so that she could do the heavy work when she had energy. She also likes to do coloring when she feels overwhelmed. She does a gratitude journal to address her negative self-talk and to keep that in check. She does online shopping, saving shopping only as a social activity with her teenage daughter. So what was the result of all of this? So we started working in 2024. So since 2024 up till now, she's lost 27 kilograms of weight and kept it down. She stopped using alcohol. She has much more energy, and enjoys spending time with her family and doing activities with them. She reports that the quality of her life has returned, and she is able now to make healthier food choices.
Thank you, Amanda. That's brilliant. I was wanting to say, and you kind of matter of fact went through all the changes that she's already done, but you
Yes.
obviously facilitate those changes for
Yes.
her. So I think
Yes.
that's the great thing that maybe wasn't so clear in your discussion. All of those things that she's changed was the insight and the help that you've obtained for her. So I think that's brilliant. I mean, how many kilograms did she lose? 27 kilograms. That's so interesting.
Yes.
And maybe something that I can share with the rest of the group. When Amanda did our course, I don't know, Amanda, was that 3 or 4 years ago? Amanda herself lost a lot of weight on the course and couldn't understand what was happening because she was implementing the sensory-based strategies that she learned from doing her own sensory matrix. And that kind of was a facilitated process for her to start to use the same principles and the same progress that she's done on the course with her clients. So I think that's wonderful. Thank you so much, Amanda. That's really great. I wish we could give you a big applause. And also just to share with the rest of the group, absolutely well done. This is the quest for this year that we are going to be collecting these case studies because I'm constantly hearing the good work that practitioners are doing using these principles and using the matrix and using the associated frameworks with their clients, but we are not documenting that enough. So I'm putting it out there. There will be a publication towards the end of this year where all of these case studies we will be discussing, or we will be putting that into a case study. So thank you so much, Amanda. That is absolutely brilliant. And you were even right on time. So that's great. And sorry, I was pushing on some of the slide already. So good for that. Lauren, you are next. I'm just going to move on to your slides, and then you are welcome to tell me when I need to move on. So all over to you. Thank you, Lauren.
Great. Thank you. Good evening, everyone. So yes, I'm Lauren van Gelder, and I'm a mental health OT. I've completed my training in sensory intelligence many years ago. Currently a licensee, and I think the Sensory Matrix is just a wonderful user-friendly tool that provides so many insights, especially, like I said, from a mental health perspective. Okay, I can change the slide. We'll go to the next slide, please. So in terms of my case study, it's on a 25-year-old woman who was referred to me end of last year for occupational therapy during her mental health hospital admission. She presented with a history of anxiety and depression with a previous admission 5 years prior during her university studies. At the time, she struggled academically, felt isolated, and eventually dropped out of her BA degree. And since then, she had not entered the formal job market, but assisted a family with long-term live-in household and pet care. Her boyfriend, whom she described as being less expressive, lived with her, and she often spent long periods alone at home as her boyfriend's job required him to report to the office. Okay, you can go to the next slide. So in terms of the presenting concerns, she obviously reported a decline in her mental health, describing feelings of stagnation and lack of personal growth. She struggled with self-care, had limited energy and motivation, and withdrew from leisure and social activities she once enjoyed, such as drawing, writing, and gardening, and often only found herself leaving the house for obligations such as shopping or taking the pets to the vet. She experienced constant anxiety, poor appetite, fatigue, sleep difficulties.
Oh, Lauren, you've gone on mute.
I'm not sure why.
Oh, there you are back again. Go for it.
I'm back. So she experienced constant anxiety, poor appetite, fatigue, sleep difficulties, and frequent negative or suicidal thoughts. And obviously, she relied on marijuana to manage her sleep and appetite, which she recognized as an unhelpful coping strategy. Her daily routine was very minimal, often starting late in the day, focused on chores and passive activities or entertainment, like YouTubing and Netflixing. She noted a decrease in the quality of her relationship with her partner. And during the initial sessions, she was extremely overwhelmed by her emotions. You can go to the next slide, please. So in terms of our therapy goals, together we identified goals to improve her well-being. Obviously, we wanted to focus a lot on developing emotional regulation strategies and improving her self-care, rebuilding a healthier daily routine with meaningful activities, increasing social interaction and support, and exploring future work or career opportunities. And that's why I decided to use the Sensory Matrix, because I was like, this will be a brilliant tool to use because it can provide valuable insights to guide the process of reaching all of those therapy goals by using various sensory strategies to improve her well-being. So you can go to the next slide. In terms of her results showed that she's generally sensory seeking, so high threshold. So meaning she benefits from variety, stimulation, and active engagement. Her current lifestyle, which lacked stimulation and variety, was therefore contributing to her anxiety, depression, and poor state of mental health. So obviously, we tried to then focus on giving her more sensory input that was especially in line with her high threshold. So when it came to smell, taste, movement, just incorporating more of those sensory strategies. So you can go to the next slide. So our intervention included sensory-based strategies for self-care and emotional regulation. So we explored sensory tools, and I'm a big fan of fidgets, And she was highly anxious and restless in the initial sessions. So she actually chose a Poppet fidget. I'm not sure if most of you are aware of what a Poppet is. I don't have the exact one here. I'm using my 3-year-old's one, which is not quite the exact same thing, but basically it's got texture on it and you can pop it and move it. It's obviously smaller and discreet, the adult ones. And this just provided her with movement input, which helped her to manage restlessness and anxiety, allowing her to participate more constructively in therapy sessions. And then we also just looked at other relevant strategies, sensory strategies, to promote emotional regulation, which included breathing exercises paired with use of calming scented lotion and hand massage. So obviously also just giving yourself like deep input into her hand muscles or into her hands, which also helped with improving the anxiety. And then we also just focused on promoting self-care and balance. So where we looked at her having to prioritize rest as well as quiet time alongside activity, especially due to her fluctuating sensory thresholds, which required careful management. Next slide, please. We also focused on sensory-based activities to improve her daily routine and social interaction that aligns with her sensory matrix results. So she started daily outdoor walks, participated in group Pilates sessions, as well as creative expression activities in group sessions as well as individually. And this just provided her with stimulation and positively impacted her mood. And she learned the importance of having a basic routine with some non-negotiables for every day. Also, we looked at enhancing, we also looked at enhancing her, I don't know what's going on here. Let me put my slide. Let me just open it again. So we looked at enhancing her relationship insight using, wait, am I at the right place now? Sorry. So sensory-based education also just provided her with increased understanding into different sensory processing styles, which helped her to relate more compassionately to her partner's style and improve their communication. And then can we go to the next slide, please? We also looked at sensory-based education to understand which environments support her sensory processing style. So we focused on future planning and goal setting, where she began to explore volunteering opportunities. So she focused on volunteering at an animal shelter as well as a palliative care facility to add structure, social interaction, and purpose. And she also expressed interest in pursuing nursing, recognizing her preference for practical caring professions. And this provided her with insight into why previously studying a very theoretical and somewhat vague BA degree was not a good fit for her. And then she also planned to resume gardening and walking pets. We can go to the next slide, please. So if we look at the outcomes, during admission, we saw improved well-being. From a self-care perspective, we know that her routine was well established. She was able to use techniques to self-regulate far better, such as using the scented lotion, the breathing techniques. She was able to prioritize rest and downtime with activity. And she reported more consistent grooming, healthier eating patterns, and better sleep hygiene. And there was definitely an observable increase in the independence and confidence in managing her daily needs. We also saw improvements in her emotional regulation. So there were definitely reduced objective signs of anxiety during sessions, and she became less reliant on external support for emotional regulation. And over time, she showed increased independence in managing her own emotions with consistent self-regulation. We also saw improved participation in leisure activities. So she started doing tasks that previously brought her joy, such as her drawing and her creative activities, as well as the outdoor walks and the Pilates that provided her with that sensory stimulation and also positively impacted her mood. She began experimenting with creative outlets and reconnecting with activities that previously brought joy, as previously mentioned. But in all, her leisure activities became purposeful and restorative rather than passive, which contributed to emotional regulation as well as self-worth. We also saw improvements in her social interaction and social motivation. So with her exploring her volunteering opportunities to add structure, social contact, and meaning. but also she reported improved communication and understanding in her relationships, especially using sensory insights to appreciate her partner's needs. And she displayed increased willingness to leave the house for positive activities and not just obligations. And she showed both confidence in interacting with others, which would lay the groundwork for future vocational engagement, such as pursuing a career in nursing. Also, we saw increased or improved self-awareness and self-worth because she showed renewed motivation and hope for a future, particularly in exploring career paths. And by engaging with the sensory matrix, she was able to find purpose in everyday activities and recognize how small, meaningful changes could support her well-being. And this helped her shift from feeling stagnant to seeing possibilities for growth and contribution. She also developed a greater self-compassion and improved understanding into other sensory processing styles and needs. And through therapy, she realized that her struggles were the result of a lifestyle that did not meet her sensory and emotional needs, rather than a reflection of personal failure. This reframing re-strengthened her confidence, reduced self-blame, and allowed her to view herself more kindly. And the last slide. You can go to the next slide, the last slide. Thank you.
I'm going.
So if we look at the overall impact, we can see that the sensory matrix just gave a language to understand herself and express what she could not express or understand. So it just helped her with, gaining insight into her needs and reframing her struggles as mismatches between lifestyle and her sensory preferences, rather than personal failure. Sensory strategies helped her to regulate her emotions and reestablish routines and reconnect with meaningful roles. And positive outcomes were visible in her daily functioning, her emotional stability, and renewed motivation for future growth. So she found it really helpful because as she reflected on the fact that it helped her to understand herself better, and she realized that she needed more stimulation and variety in her routine. She reported feeling more confident, more compassionate towards herself, and she had excitement to explore volunteering and future career options.
Awesome.
Yes.
Thank you so much, Lauren. That's really, really
Yes,
awesome. And I'm so glad you chose a case with high thresholds, because we do see quite a strong gravitation in the usage and in the application towards people with low threshold and sensitivity, because the overlap into particularly depression and anxiety is so clear. So it's really, really great to see someone with the other extreme on the results, because that also accounts for those mental health problems that you've so rightfully pulled out there. So thank you so much. I know Lauren and I remember when we had a call once, when I actually had chats with therapists a long time ago, and you were so excited and also sharing the tools that you use in your clinic and in your practice that you have available that people can explore with. So thank you so much for sharing that, Lauren. That's an awesome case study from your side. Great. And then second is Loanne. Loanne, over to you. And I'm glad Loanne has chosen a male, and it's not about stereotyping here, but I think that's also a little bit of a thinking to say that more women have got low thresholds, but it's so not true. I think there's really no gender bias and there's really no culture bias. So I think it's nice that we are seeing a mixture of results and type of clients that we are seeing here. So over to you, Loanne, and then I will manage your slides for you as well.
Thank you so much, Anna-Marie. Thank you for having me. I'm very excited to share this case study with you. I'm also a sensory practitioner, and I've done the course. And I must tell you, I'm a very proud sensory intelligence user, and I really try and incorporate it as much as I can, alongside some other tools. So tonight we'll be talking about Mr. Swart. He was referred by his psychiatrist, and he's a successful architect, but he was just not coping in all the different kind of work environments. So that was probably the biggest challenge for him, especially when needing to go onto construction sites, busy office environments, and like Anna-Marie said, a male, but also not having any insights that this was actually a reason for him feeling overwhelmed or anxious. So he was, at the time of his referral, he was going through a depressive episode. he had a partner in his business and 7 employees working under him. Okay, Anne-Marie? Okay, just a little bit of background just to give you some context. So he lives with his wife and he's got 2 young boys, which made bath time also quite a challenge for him after his long day. He was also carrying a lot of financial responsibilities for his aging parents, and he had a difficult childhood. So when I saw him, he presented with high levels of anxiety, burnout, and he was struggling with his work-life balance, managing all his responsibilities. That was a big load he was carrying. Definitely time management during the day and work and personal boundaries, always responding to WhatsApps, being available for calls. That was definitely one of his challenges. So as I said, the on-site work overwhelmed him. He struggled to fulfill his design work, which made up about 60% of his workload. And that was actually the work that he enjoyed most because he was deep level concentration, quiet environment. I think it was almost a regulatory tool for him and part of the work that he enjoyed most, but couldn't get to. So yeah, he wasn't fulfilling his design work on time for new clients to provide that with quotes, and his productivity and self-confidence had been affected through all of this. Thanks, Anne-Marie. So just some of the assessments I used. So the Senses at Work, I really like that using that questionnaire because it provides you with insight, but it's not too much for the client or the patient to be able to understand and apply to their work environment. Sometimes they do apply to your home environment too. So yeah, he had really low thresholds, -33, as you can see. I'm just quickly going to pull up his results. So his lowest threshold was for auditory, it was -9. And then he was also very sensitive to touch, -7.5. And then smell and taste was -4.5, movement -4.5, visual -4, and multisensory -3.5. So those are more medium ranges, but mostly low thresholds. And then another nice tool that we learned about in the practitioner's course is the sensory overload risk assessment, which I use a lot. And that's basically an assessment tool where the patient can rate their work environment in terms of overload. But what's nice is that it really describes what they're going through. So it also puts a numerical value of, okay, 75% of the time I'm overwhelmed by noise, and it really gives them the words and the options. So he had 23 out of 30, which is extensive discomfort within his work environment, mostly in construction sites and at the office. The office was also overwhelming for him because as soon as he would get there, everybody would approach him with questions. So that was also found to be a difficult working environment for him. And then I also used the HADS, and we found that his scores for anxiety and depression were quite high.
Thank you. And before we move on, I just want to mention to maybe the audience might not be familiar with Senses at Work. The Sensory Matrix is the tool that I actually designed first, but what has happened, Senses at Work was an add-on or a supplementary tool which kind of measures the same threshold types, but just in a different way. The questionnaires is a little bit different and it provides a shorter assessment. This assessment was developed after COVID during lockdown. We did a lot of work with clients, and it was so clear that the low threshold group loved lockdown. They loved the fact that I had so much control over their environments versus the high threshold group would totally had the opposite impact. So Senses at Work was designed to help people to look at space, work environment, and be very work specific. I just interrupted you there, Lo-Anne, just for context.
No problem.
Wonderful. Yeah, there's the results.
Okay, there we go. There's the results. You can see that's probably one of the lowest scores I've had in the past. So when I saw it, I was like, oh, this is definitely the right tool to use for him. And he gained so much insight, and I really think it's made a big change in his life. So yeah, that's just a nice visual representation of looking at his results. Okay, Anne-Marie. So some of the recommendations I made was that he temporarily focus on working at home and at the office, and that his partner do most of the construction sites, which was nice because he has got a work partner or a business partner. And Also looking at his weekly routine. This was a big game changer for him, you know, having specific days that he'd work from home and then specific days that he would go into the office, specific tasks he would do at home versus office-based tasks. And that really made a big difference. And then clear boundaries, putting away the cell phone so he could actually focus on his design work. He almost, his design work was like a reward to him. So yeah, so that also for him to gain that insight and a regulatory strategy. So that was really nice. And it was a nice match between person, sensory system, and type of work, which is nice to see. Optimizing his work environment. So because he's a architect, it was also nice to kind of gauge with him a little bit about how important it is because he's very detail oriented, very visual, how important it is for him to have a nice big workspace. He's quite a claustrophobic guy, that you would see in his touch, he scored -7.5. So even in my office, you know, I could see he's one that likes a big bubble around him. And specifically for that, I also recommended that he'd rather use the boardroom at work rather than his office, because his office was quite small. And then obviously all the sensory strategies that were suggested through the work senses questionnaire as well. Calmer, not that I am sponsored by them or anything, but Calmer earplugs, they allow some noise through, but it's kind of like a barrier or a buffer. So he would use them at work so he wouldn't be seen as so antisocial. And he would also use them at home during bath time. And then obviously prioritizing his well-being, stress management, getting rid of the stereotype and the stigma around mental health, middle-aged men. I think that also gave him a lot of insights, and for him to have a safe space. So he saw a psychologist and a psychiatrist, and I think it really helped him to get through this depressive episode. I'm just making sure there's nothing else that we incorporated that's not on the slides. Wearing comfortable clothes, because he came to me and I could see he was quite uncomfortable in his clothes, but he didn't realize. So that was also a change. Yeah, I think that was all that stood out. He came to see me for a few sessions over about 2 to 4 months, and we would then slowly reintegrate him back into construction site work. Okay, Anna-Marie, I think we can change. And then the outcomes at the end, what's nice to use is to use the HADS again. And as you can see, his depression and anxiety subjective scores had decreased a lot, which was also nice for him to see and to actually go through that with him and say, okay, this is how it was before and this is how you are now. Can you relate to that? Are you experiencing that? And then obviously increased productivity, which was a big one for him. He is a business owner. He's in a professional line of work. So being able to complete his design work on time, which is his passion, and then improved well-being and emotional regulation at work and at home. Also, I think thinking back now, it would have actually been nice to have his wife join for one session. I do that now more often, and I'm actually seeing quite a lot of patients with their business partner or with their PA, and it makes a big difference. But improved well-being and emotional regulation at home and at work, that definitely took place, especially on the days that he worked from home. He would tell me those evenings he would be in so much a better space to be able to spend quality time with his boys. Sustainable work routine. For me, that's a big one because he needs to be doing this for another few years at least. And for him to be able to incorporate these strategies and actually make them last and maintain the well-being so he doesn't have a setback in the near future. And then slow reintegration back to the office and the construction sites. When he was originally booked off by the psychiatrist, he actually worked from home for a while. I think it was about 2 to 3 weeks before going back to the office. And I think that period of stability also helped him. And yeah, improved self-management and assertiveness within his company. That was a big one because he's quite a young partner or business owner of a successful architectural company. So for him he was very sensitive around offending his employees, or telling them, sorry, I can't address this now. So we looked at a lot of examples and scenarios of how we can manage that. All right, I think that's that.
Oh, and thank you so much. That's such a lovely story. It's just made me think the other day I spent a little bit of time on Lion's Head. I'm a little bit of a mountaineer, and I met a guy who said he wants to actually do something around male mental health and well-being, because as you rightfully say, they see it as such a stigma. It's so hard. I would think it's harder to actually be working in the male population with this, and it's got the same amount of impact for them. So thank you so much for sharing that really, really
Thank you for
powerful
the
case study.
opportunity.
Yeah, that's really, really awesome. I'm going to stop sharing because this is really what I wanted to get across with you. And I think these 3 case studies are, it's a little bit of the tip of the iceberg. And I was seeing Melanie de Villiers' name on the call, and we need to grab her in because she's also done some phenomenal formal work with stats and involvement for post-mental health discharge work. So this is really the stories of many, many other people that has been involved or using sensory processing as part of your toolbox. It is not the only tool, it's part of the toolbox. And, obviously I've asked Amanda, Lauren, and just to focus on what they've done from a sensory element to show what impact that can have, but it obviously works together with what you are obviously doing. So we've got time for questions now, and I really wanted us to allow time for that. So Marianne, I'm going to ask that we put it over to you.
Yeah.
And if there's the more highly intense mental health type of questions, I am definitely going to refer them to our panel here, because I've done mental health work way back, but I'm not in any kind of diagnostic clinical space anymore. But we would love to have your questions. Marianne, over to you. Have we got questions that we would love to get to go
We've got
through?
a couple here. They have more to do with the work that you've been doing. So the one question is whether it's possible to have access to your research slides with the links to the research.
With the links to the research, absolutely. Look, we can definitely make these slides available. I will ask Vanessa, who's going to send it out to you afterwards, to have those slides available anytime. There's a lot more research that needs to happen. Those of you who are interested in research, you can also go onto our website. We do have a research function with a lot of the research on there, but I must admit, I've got research on it. Sometimes feel in a million places across my head and my system. Just my own research, my PhD that I've done in the call center space is available to read. It's heavy reading. It took me 7 years to do that, so I did not produce an article after that. In hindsight, I'm quite sad I didn't do that, but at that stage, I just had enough. I couldn't do any more. And then just the matrix standardization study, it has been submitted and rewritten and submitted again and rewritten. We are waiting for the final submission onto that, but I'm still busy with the validation and standardization study on the sensory matrix and sensors at work. But my PhD is available. And then I do share a lot of the other research. So I will share the links with you. I'll share the slides with you. But as I say, there are so much new emerging research that happens all the time. What I also have that I could potentially share, if any one of you would be interested in that, I think last week, I presented with another therapist for the Canadian Occupational Therapy Association. And then we also shared all of the assessment tools for adult sensory processing, with referencing and also how the sensory matrix are different to those. Because I literally put the matrix together because all the other adult sensory processing tools that was out there didn't give me specific around systems, because I needed the system specific scores. Because if I know you're sensitive to noise, I know what to do with noise. If I know you are seeking movement, I know how to bring that into your either mental health or your well-being toolbox. But I can also share that with you, and very happy to do that. I can maybe also ask Vanessa to just share that in the link of information that's going to go out. Marianne, anything else?
Another question was where to find the SORA.
That is available to anyone who's done our practitioners course. It is actually a tool that I've put together because when I did my initial research up front in call centers, it was a bit of a struggle because I started this research in 2004, and I was positioning it in a commercial industry. So the commercial industry had no clue what sensory processing was all about. And in the sensory processing field, there were no real, exposure or utilizing it into a commercial space. So The SORAR was put together to really map out, if we say people have a low threshold, does the individual experience their world as overloading? So I was wanting to map what we are asking with sensory-based questions, really just going through day-to-day life experiences, where we map out the threshold, but then do people then experience the environment to be overloaded? But that's available to people who has been through our practitioners course, and I think a lot of you on this course have been available, so that is available for those people who's done the course. And it was really trying to get a subjective feedback of how people are experiencing their workspace in particular.
And then we also have quite a complex clinical question. So I wonder if Anna-Lane wants to expand on it, but I'll read what she wrote here. It says, do you have any adapted approaches for PDA, persistent drive for autonomy, or pathological demand avoidance? And thank you for an informative webinar. Yeah, Anna-Lane, I don't know if you want to weigh in on that question.
Yeah, and then I would definitely not even volunteer to answer it. I will probably hand it over to Marianne or the rest of the other team, because I know Marianne works in mental health on a regular basis. So Marianne, if you understand the question better, you would be a better person to answer it. Or if Amanda, Lauren, or Leanne wants to, you are also welcome to do so.
Yeah, I think from my side, I mean, that's a very tricky diagnosis to treat. I think in terms of using the sensory matrix for this type of clinical picture, yeah, we would probably look at what regulation is needed when this person is triggered. I often use the sensory matrix in conjunction with emotional regulation. So I think with this type of clinical picture, that's probably where you're heading, is seeing it. Where is the trigger environmentally? Because a lot of this pathological demand avoidance will be environmental specific or specific to a type of activity, and look at how that's triggering on a sensory level and what emotional reaction the person is experiencing, and then helping them to either adapt the activity, avoid the environment, or regulate on an emotional level. There's a lot more discussion on this. So there's more questions around ADD. Sorry, Anna-Marie.
Yeah, I was just also wanting to mention, remember, the assessments that I've designed is not there to diagnose. They're not diagnostic tools, not at all. They are literally tools to try to understand how does that particular person's nervous system respond to the environment, considering all of the external senses. So we focus on exteroception, not interoception. Interoception is important, but we are not mapping or measuring that with our assessments. We are trying to understand how does the environment influence that individual through all of those triggers, and why it's such a powerful force to use, because then we can adapt the environment accordingly. And I think that's just what happened in the work that I've done. I did a lot of work with autism, and in autism, I could see that if you manage the environment, your treatment sessions were just so much better. So environment is a therapeutic tool, was something that I very quickly and very early in my still clinical work could identify that. But then as I was starting to utilize it with normal functioning adults out there, I could also see the benefit of mapping or understanding the environment and the environmental impact. So I think that's where there's always a focus on trying to understand the environment, because they are the conduits for what is happening through the nervous system and through to the brain. But none of our assessments are diagnostic. It's not diagnostic. It's really a self-empowerment and a self-education tool. And maybe something that I think would be interesting to see, we also would potentially map, I know I've seen this, we have two clients with exactly the same scores. Let's say both minus 33. I'm going to use Loanne, your client with a minus 33. We could have two clients with a minus 33 score. One is coping absolutely perfect, and the other one has been diagnosed with depression. Okay, so then it's also, we go back to context. What is happening in that client's life? Do they have the right context? And then often the difference is in context. Where are they? What are their lives all about? And how well they are self-regulated? And have they set up their right environment or their lifestyle to meet their sensory needs? So I'm finding that happens a lot. Is there a sensory match, or is there a sensory mismatch? When there's a mismatch, then it's often where there's more advanced or more progressive problems, or people actually experience a lot more anxiety, or that could potentially also lead into those diagnosis. And where people have got a good match, they understand their environment, and this often happens intuitively, or through trial and error, people have created the right type of lifestyle activities or environments for them. We find that those individuals, even having a very low threshold, is coping beautifully. So remember, what we are mapping out in general is there's no right or wrong with what we are measuring here. It's just how is it contributing to the problems that people might have. And in this particular webinar, we are linking it then obviously with diagnosis. That was a long explanation. Marianne, back to you.
Yeah, so there's a really good discussion going on around here on PDA, so I don't think we'll go into much more detail there. There's another question that says, if a patient should be in severe depression and low functioning, do you expect that their results in answering the sensory matrix would be accurate, that one can work with adequately, or do you expect that they would have to redo it when the patient improves?
Marianne, you can answer that, but I just want to answer that quickly. I never designed the sensory matrix for acute conditions because it's not a diagnostic tool. But having said that, there have been a lot of therapists who have been using it in acute settings, to my surprise. And I've checked in with a lot of these practitioners, and in those cases, the psychiatrists have seen, or the referring medical practitioners have seen what the sensory matrix report provide for these clients. And then they said they are using it even in acute settings to give people practical, tangible strategies and results that they can immediately implement to help them cope. So it's a lot around short-term or quick fixes for managing overload and anxiety and stress. But obviously, if people are in a very acute state, I would really then consider that it could shift afterwards if people would move out of that acute state. And I know I'm not crazy to measure thresholds for women who are pregnant, because I've seen often that could shift, or then just ask them, is your nervous system responding similar to normal? Or is it very different to when you were before pregnant? So I think there are some of these biological factors that we do need to take into consideration. So it's not ideal, but it does happen and it can actually have a benefit. Marianne, but I don't know if you guys that's working with that has got some more detail or insight that you can provide.
The only insight I can provide there is I usually ask the patient in an acute setting not to base it on how they felt recently, like in the last 2 weeks, like you usually would with a self-report questionnaire, and rather look at their pattern of behavior over most of their lifetime. So that usually, with that type of input, I haven't seen the threshold necessarily change once the clinical symptoms get relieved.
Okay. And because if we look at how this whole concept and sensory processing have been studied and applied, I mean, we are looking here at genetic predisposition. So it shouldn't change, but it does. It does. So it fluctuates a little bit. It's not a constant. There are some level of fluctuation depending on what is happening in the client's life or where they are. But it is fairly in the similar band. You're not going to find someone with low threshold who suddenly now pop over into a high threshold category. And if that should happen, I haven't seen it. If that should happen, then it's definitely associated with either head trauma or major traumatic events. I'm not saying it's not possible, but it's highly unlikely. Marianne, any more questions?
There's an interesting one asking about sensory intelligence in babies, so children's and teens, or prenatal postpartum women, which you've touched on briefly.
Yeah, obviously, just remember most of this work has been done with children. This is where the most application is known for, have been applied for. And remember, I started sensory intelligence years ago because I was sick and tired of adults not getting the same type of, I think, focus. So my shift was, how do we take this into the adult world? Because the same principles apply. It's still very much heavily used in the pediatric world. It's also being used with babies. Please don't ask me any baby questions. I've never worked with babies, but we can determine a baby's profile probably from about 3 months onwards. And then, yes, it's very much applicable for adolescents, teens, adults, and even older adults. So that certainly is very true. And then I also just want to make a comment. I saw something flash over the screen, ADHD and autism. Our next webinar is going to focus on neurodiversity with a particular focus on ADHD and autism. Any other final comments? Marianne, I think there were some of the slides that I was just wanting to share for final. If people want to do our course, the next one starts in August again. It is a 3-month online course. We've went through question and answers. Yeah, so this is just showing you, this is the next webinar that we are planning for the rest of the year. 19th of May, we will be talking about ADHD and autism. It will be the same format. I will get another 3 speakers that actually will share case studies with us. 20th of June, we will look at wellness coaching. So that's outside of any diagnosis. 28th of July will be around relationships. And 20th of October, I want us to move into sensory inclusive design, which is a great emerging field with a lot of new application and research, which really, really is exciting for me. We wanted to also share what is happening in that particular world. And then I think just as a final, Marianne, is there anything final? We are on the dot 7 o'clock. Is there anything final in a chat box that we need to quickly go through? And then I can just finish with my quote.
No, lots of appreciation for the case studies and a lot of discussion around the spectrum disorder. So I think the next webinar will be very useful.
Brilliant. Thank you for having the conversation going. Special thank you, Marianne. Thank you for helping the back end. Amanda, Lauren, and Loanne, you guys are brilliant. I really love the work that you are doing. Please keep up the good work. And we're looking forward to seeing you at the next webinar, guys. Thank you for joining. You will receive a link to this information. If there's anything else that you want, feel free to reach out to us. We're very happy to help. And then, yes, have a great night further. And yeah, be good. Cheers.